Hey there, I am Wes, and my darling bride Cindy Dove are here this afternoon with Jason Hafer and Bill Hurt, and we want to have a conversation around why it's critical for you to be part of the Virginia Association for Personal Care Providers Fall Conference coming up on Wednesday, October 9th in Glen Allen, Virginia. We have the pleasure of being the keynote, Cindy and I do, but today we want to chat with Jason and Bill. Bill's past president, Jason's current president of the board, and they've put a ton of work into developing this program to make sure that you, whomever might be participating, whether you're a member, prospective member, or just somebody in that personal care industry, that you need to get that value. You need to be able to run a profitable business and make sure that you're really serving your patients, your customers, and so on. So, Jason, Bill, do you want to say hello real quick?
Yeah, hi everybody. Thanks for joining Wes, Cindy. Thanks so much. The VAPCP board is excited for this conference and really excited to have the two of you as our keynote speakers. I don't know if there needs to be any other reasons other than that for people to attend, but I'm sure we'll find some other good reasons for folks today too.
Yeah, hello everybody. Bill Hurt here. We've had some great conferences in the past, and certainly looking forward to this conference with Wes and Cindy. They're going to help you be able to grow your business and get a larger share of the personal care industry business. So join us for the conference. We have many other things, and we intend to talk about them a little bit on this podcast.
Cindy, do you want to say hello before I start pinging Jason and Bill with questions?
Yeah, absolutely. Hello, everyone. Wes and I, like Jason and Bill said, we're excited to come and meet everyone. We're thrilled with the impact that you're already making, but we can help you make an even greater impact through a few things that we're going to share with you. So we look forward to seeing you there.
Before I tee up the first question for Jason and Bill to give us a response and really let you know how you can get benefit and value from being a part of this cool event that's coming up, I'll give a little bit of mine and Cindy's background and why we're so excited to be there. And so I worked in construction and manufacturing, a little bit in mining and so on. I was predominantly a safety and a human resource professional through a lot of that, but I always was responsible for showing a direct improvement in profitability and productivity in any initiative that I was rolling out. And that was tough. So I'm looking at things typically through the lens of how do I get better results through anything we do? And I've realized that it really all does boil down to leadership. So that's the lens that I'm going to be asking the questions through. Cindy, however, has worked in and around the healthcare industry for 25 years or more. And we still support several clients in that industry today. And it's just near and dear to our hearts because it can matter so much to so many people. Now, with all that in mind, we also know, even though I'm going to talk a lot about productivity and profitability, we know some things are out of our control because government agencies, especially when we talk about Medicaid funding and payment, that can be a hot topic, right, guys? So, Jason, one of the things you shared with us.
Absolutely.
Yeah. One of the things Jason shared early on was a change to the CMS access rule and really about how it impacts the folks that are predominantly serving Medicaid patients in the personal care industry. You guys want to touch on that a little bit and how you've got a resource as part of the conference that people can benefit from?
Yeah, absolutely. Thanks for remembering that, Wes. So everybody out there is in the industry is pretty familiar with the term CMS access rule, or more commonly known in this Medicaid space, the 80-20 rule, right? Which at some point is going to dictate to us as agencies what percentage of our revenue has to be passed directly through to our caregivers as wages. And we all recognize that that's going to be a hugely impactful change in how we do business. And so we have a great resource, John Joseph, who's a local Virginia attorney who's really knowledgeable in the industry, works with a lot of our member organizations to provide them legal and regulatory counsel, is going to be coming out. And in addition to, other regulatory changes that may be on the horizon or happening in the Virginia and national marketplace, he's going to do a little bit of a deeper dive and a little bit of what you need to know to prepare for the implementation of the CMS access rule. It's got kind of a long delayed implementation. However, The reality of it is such a long implementation because we need to be making changes now. We need to be looking at how we do business today. And so John's going to give us some of the background we need to know in order to really set up our agencies to be successful in the future.
Bill, what would you like to add and share on that?
Yeah, definitely. We need to look at it now. We have a window of opportunity to tighten our operations up to where any of the expenses that we can cut. We also have an opportunity to lobby to get some of the items in that rule changed to make us be able to continue to operate. So it's something that every provider needs to come to the conference, find out more about how you can impact it as a provider, so that you can continue to be into a profitable business.
Cindy, I'm going to toss this to you and kind of get your feedback on how some of the things that we've seen leaders in different levels of organizations. And please understand, guys, when I'm talking about a leader, I'm not talking about the boss. I'm talking about the person that's earned influence, because if it's just a title, and that's a lot of what we'll talk about in our session, if it's just a title, that's not necessarily leading. That might be managing at best. But how can we lead and really help address? We may not be able to impact the funding, but how can we get better results out of what we do have through leadership? Cindy, do you want to address that?
About how we can get better results out of what we do through leadership? Well, effective communication comes to mind. There are thousands and tens of thousands of dollars lost each year or per employee due to ineffective communication. And Wes, you probably remember the stats on that, but it's one of the largest profitability losses in organizations is lost because of ineffective communication. So even if we can shore that up a little bit, we not only give our people, our team, our employees, our clients and customers a better experience, but we also become more profitable, and our clients and customers, our patients have a better experience as well.
And quite frankly, guys, I mean, Cindy and I do a fair amount of work with nonprofits and boards and so on, that sometimes profit is not even a thing in the world that they're doing. And the part that I'll say is, how can we how can we be good stewards of our resources, even in profitability? Now, most businesses have to pay attention to profitability, but even if that's not a thing we pay attention to, how can we use the resources we have and get the best results for the clients we serve through what we've got? So it's not just profitability, but it's really about how do we get the results that we're after as an organization. So
absolutely, yeah.
So Jason, another note that you and I talked about, I guess Cindy talked a couple weeks ago, managed care payer partner roundtables. That's something you've got in store at this coming event, and it's pretty fascinating. That gives a lot of perspective. Do you want to chat through that some?
Sure, yeah. So, in the past, at these conferences, we've always enjoyed a favorable support from our managed care payer partners, right? We those of us in the Medicaid personal care space in Virginia, we're intimately familiar with our managed care payers. They really are our bread and butter. They're our partners, and as in any partnership, there's challenges along the way sometimes, right? And there's we have sometimes competing interests. Ultimately, our goal is always to serve the client, to keep them home, to give them the best possible care. And that's everybody's goal. But how we go about it sometimes changes a little bit, whether you're the provider agency like us or whether you're the payer partner. So one of the things we decided to change a little bit about the conference this fall, is that we are doing a round table with our payer partners, as opposed to having them just stand up and do a little presentation on what's new in their organizations. Some feedback we received from members in the past was that those presentations became a little bit redundant because many of the payers had the same thing to say over and over. With the roundtable, our goal really is to address some of those friction points or pain points that we feel in our relationship and understand from both perspectives and both sides, how do we move beyond it and how do we get past it, or how do we best navigate those challenges? And so we're in the process of gathering questions and comments and talking points from our members, both board members and members at large, that we can then sit down and have a frank conversation, much like this, with our payer partners and say, here's what we feel as providers. Can you help us understand your perspective? And then also, how do we come together to overcome this hurdle that's impacting at the end of the day how we're caring for patients or the quality of the care we're able to provide? So a little bit different this year than what we've done in the past, and the goal being a much more dynamic conversation as opposed to a presentation, because we feel like we'll be able to really address the audience's needs and challenges in a much better way than if we just have MCOs stand up and present. So the MCO partners are excited about this because they don't always enjoy just kind of standing up and doing a presentation. They want to work with us. And so everybody's excited about this. And I'm particularly excited about it because I think it's going to allow us to have more value from this topic today or at the conference.
Well, gosh, Jason, I'm thrilled to hear that piece. And we lost Bill. Bill's traveling a little bit, so he'll get back on with us. But that's the price we pay for responsibility, right?
Right.
But I'm thrilled to hear that the MCOs want to be part of that because,
Absolutely.
I mean, one of the things that Cindy and I are so excited about, too, is it's not just the presentation we do at the beginning of the day, that you're allowing us to hang out and kind of interact and
Absolutely.
be available for one-on-one conversation. Because, hey, the reality is in a big group setting, it's not going to serve everybody at the same level the same way. It's really about how can we make sure that we're delivering a message that people can internalize. So it's cool that you're putting that together.
Yep.
And for what it's worth, guys, on the back end, I see Bill's there. There he is. We've got Bill back. Cindy, anything you
Sorry,
want to add?
technical.
Well,
Yeah, I'll just add that I love that you, Jason, and the board, the team are pulling that concept together for a roundtable, because there's nothing quite like sitting across the table from someone and truly understanding the other individual. It's a whole nother level to the relationship with that understanding, and it helps teams and individuals get to work then really helping, that prime person that everyone has their best interest in heart for.
Yeah.
Yeah.
And hey, the reality for Bill and Jason is you all live this industry too. The board isn't your gig. That's your, hey,
Right.
that's a volunteer role, right? All
Absolutely.
these things matter.
Right.
So Bill, I'll toss this one to you to start with. One of the other pieces that Jason shared with us was a part of the conference is dedicated to better advocating for agency partners. Maybe you'll clean up what I just said there because you know it more intimately than me, but talk about how you're building that in to make sure everybody participating really gets the most value from that.
Well, we want everyone to get the value out of partnering with other providers. We feel like our voice is heard in Richmond by our legislators when we work as a group. We can get way more done as a group versus being an individual up there. So when they hear us as a group and they know there are many agencies in the state, there's about 392 agencies, I believe, currently in the Commonwealth of Virginia. So when we band together for a common cause as a total group, we can be heard much better and have some things be able to move in our direction to affect some change that's positive change, not only for us as agency providers, but for our caregivers, for the clients we're serving, to give them better quality of care, which after all, that's what Jason and I and the other members of the organization, ultimately, that's why we're here in this business, is to provide quality of care for our clients. And we want to provide a great work environment for our caregivers.
Yeah, absolutely.
So, we do. Oh.
You're good, Bill. I'm sorry.
Yeah, I was going to say we do have a lobbyist that'll be speaking to the group at the meeting, talking about how we can band together some of the things that we're working on as a group and how each and every person that's part of our group, and even those who are not part of the VAPCP, how you can become involved and a team with us and all the other providers in the Commonwealth. So with that, Jason, if you'd like to add anything that I missed.
Well, Bill, I think you touched everything. You touched on it, and I'm glad you brought up Matt Cobb, who's our lobbyist. Matt's going to be doing kind of a grassroots advocacy session for us, and he's going to help us because we talk about advocacy and we talk about having a voice and we talk about influencing change in Richmond and beyond. But I'm not sure that those of us as personal care agency owners always know how to get started in that journey, right? How do we become good advocates for our industry? We know we have the stories to tell. Trust me, Bill and I could fill 3 days worth of this live stream with stories about lives that have been impacted by the care that our teams provide. Not me and probably not Bill, but our teams are really the ones out there doing hard work. But how do we take that message to Richmond and beyond and let the folks that influence things like reimbursement rates and quality care initiatives and all of those kinds of things, how do we let them know and understand the impact that we have on lives and how we truly improve lives for folks all across the Commonwealth? And so Matt's going to help us as agencies understand what that means and help us to kind of craft our plan to advocate for ourselves in our home districts, our hometowns, our cities, wherever we're from, and be able to really influence those folks who make some of those decisions. Additionally, we kind of have a brand new committee that's coming to VAPCP, which is our legislative committee. The inaugural meeting was yesterday, and we are kicking off a kind of a membership benefit to allow more folks to participate in crafting the legislative initiatives that VAPCP is going to pursue over the coming years and months ahead. And so we're going to talk more about that at the conference. I'm excited to share that news and invite members to participate because I think that's a great way for us to find our voice that Bill talked about.
Guys, I'm thrilled to hear the lobbyist, the legislative resource that you've got. I mean, Cindy and I live here in the Central Shenandoah Valley, and a big part of our economy is poultry. And we're very, very close friends with the fellow that serves in that role for the Virginia Poultry Federation. And I watch what he does, and to know you guys have that because it's very similar in scope. Yeah. I mean, you impact a lot of lives. It's a tremendous part of the tax base based on what your companies pay, and you provide both care for and livelihood for a lot of people. You've got a wide reach. So it's important that the folks that are, I'm going to call them politics, spelled TICKS sometimes, it's important for them to know, hey, there's real people that we're impacting through these choices we make. So that's fantastic.
Absolutely.
Jason, you touched on it briefly. So that's the next thing on my list, and that's really the reimbursement rate. We're looking at it in Virginia in January 2025, yet another increase in minimum wage. And please understand, when I say this, guys, I'm all about people earning a fair wage. But I'm going to stress the word earn and so on. But hey, when that arbitrarily gets moved up, it impacts everything else in the sector. And that's the part that needs to be considered.
Yeah. And it's interesting because in our space, in our world, the world Bill and I live in, we don't have the luxury, and I don't want to call it a luxury, but we don't have the leverage that some other industries have, where if minimum wage increases 41 cents an hour, there's ways, that might mean that the price of a Big Mac goes up, or that might mean that the price of a delivery service, increases by a few pennies for each one. And the aggregate increase that you receive offsets that minimum wage. For those of us that are largely Medicaid funded, and we're reliant upon outside entities who set the reimbursement rates that we can collect, when there's a 41 cent increase to every hour of cost of care, we have to understand and figure out where's that going to come from. Because it's not like there's an extra 41 cents there today that suddenly tomorrow we're like, I was wondering where I was going to put that 41 cents. Right. We need to figure out where it's going to come from. And that usually means sacrificing something. And we don't want to sacrifice quality. We don't want to sacrifice Obviously we don't want to sacrifice benefits for our caregivers. We believe that our staff who do the great work, they deserve to have a livable wage and have benefits and have the things that really make this a true career opportunity for them. But that gets overlooked sometimes in kind of the trickle down effect or the ripple effect of things like a minimum wage increase. And so, one of the things that the legislative committee is going to talk about over the next couple of weeks is how do we, now that we know this is coming, how do we take this message to Richmond, to the governor's office and to the legislators and say, we need to find a way to help agencies cope with this and help offset this cost, whether it's through a rate increase, whether it's through a modification of some of the regulatory restrictions and oversight that we see. Because if we could reduce some of the paperwork we have to do, every day, then maybe that allows us to find ways to not sacrifice on care, but to still be able to be sufficient and provide great care without some of the, sometimes the busy work that regulation has us doing. So there's lots of great conversations that are going to happen around topics like that at the conference and beyond. And so, definitely another great reason to attend.
Bill, anything you'd like to add?
So, Jason, you hit the nail right on the head. Our expenses continue to rise just due to inflation, but we're required to have registered nurses on staff. And unless you've been stuck in a hole somewhere, that the registered nurses, there's a huge shortage nationwide. So we're paying more and more for those registered nurses and finding it harder and harder to attract them into our industry. So that's an expense that, so if we could, one of the things we're asking is that we be able to use licensed practical nurses to do the work that the RNs do, the registered nurses do. So that would be a little bit of a cost savings. We're also asking for our nurses to be able to do virtual visits. So that would, help us with our cost a little bit. So there's ways we can cut if the regulations were changed, but we do need the rate increase. There was a study in 2021 that said we should be reimbursed at $31.21 an hour, and today we're sitting at $19.83 an hour. So there's a huge gap in the study that was commissioned by DMAS, by an independent third party, from what they said versus where we're still at today.
Yeah.
Cindy, anything you want to touch on with that as to how any of that relates back to the topics we're going to work through?
Well, you asked about how what related to leadership earlier, and I mentioned effective communication. It also relates to building relationships, and the better we can have our culture. So we're going to touch on this a little bit, but the better we are as leaders and relate to our people, the less recruitment and retention challenges we have. The less turnover we have, then turnover is incredibly costly. So that really impacts that bottom line as well. Yeah. Is that what you're looking for, Wes?
Yeah, that the recruitment and the retention specifically is the piece. And guys, you guys see this in your industries, I'm sure. I've certainly seen in every industry that I've helped recruit for, I've worked in personally, whatever, is that, well, I'll just use Bureau of Labor Statistics average. They cite just below 25% annual voluntary turnover rate. And they say anywhere from half the employee's salary to 5 times that employee's salaries, depending on role, responsibility, knowledge base, and so on, is what it costs to replace somebody, total direct and indirect cost. And if that's accurate, guys, Bill, I think between your company, if I remember right, you're 150-ish employees, or is it a little bit more than that?
Our company, we're at about 550 folks.
Okay. Well, let's say if that 25% is right, and let's just use small numbers because Wes isn't a very smart guy. Okay. Let's say 550, 25% of that's 125 people, 130 people. let's use $30,000, and let's use the low end and say half of 30,000 to replace them is 15, and you in theory lose 125 to voluntary turnover every year because we're average. Times $15,000 is
it's a lot.
Yeah.
That's phenomenal.
It's almost $2 million, and that's on the low end at Bureau of Labor Statistics averages. And the reason I share that and go into this detail is when you've got to look at that with, here's our reimbursement rate, that money just doesn't magically appear. That's in your cost that you deal with all the time anyway. And if we can build better leaders at every level of the organization, and you've got less turnover, if we can drive, what if we just cut that in half? And you've got less turnover. Gosh, you're not training new people, and realistic. I'm not throwing stones at new people, but that's where care issues can happen too, right? That's where if you're out doing personal care, providing for families, for individuals, wherever, if that relationship's not there, that's where a dip in the quality can come from too, right? And if we can eliminate those costs and increase the quality of our service because we're just keeping good people, we've minimized turnover, and we just did it because we led more effectively, we took better care of people, man, we can drive a lot of margin and take better care of people in the process. So it excites me to be able to address some of those things. We won't fix all of it, but how can we control what we can control, right?
Yeah.
So sorry for the soapbox dialogue there, but what am I missing here, guys? Cindy and I are just giddy about the time with you. I put in the comments, and I don't know if Cindy's been able to put it over onto LinkedIn, but I've put where to reach out to register. We're working on possibly an online registration, but if you're not registered, if you're seeing this, whether it's live with us or seeing a recording, to register, send an email to Amber, AMBER, at ACSWest.org. And again, that's in the comments on Facebook, YouTube, and it will be if it's not already in LinkedIn. But send an email to Amber, and again, we'll try to work on having an online registration if possible in the time frame. But what else are we missing here, guys?
So there's two things, maybe Wes and Cindy, Bill, that I'd love to just touch on. Number one is I don't know exactly how to do this, but I'm happy to provide my email address as well. If anybody has any direct questions that they want to ask before they reach out to Amber to register, my email, you can reach me at Jason, JASON.Hafer, HAFER, at HomeCentris, and that's all one word, HOMECENTRIS.com. So HomeCentris Healthcare is the organization I work for, and that's my day job. VAPCP is my passion, so to speak. So I wanted to touch on that, and please feel free to reach out, ask questions. I can guide you through. I can introduce you to Amber. We can get that taken care of. But additionally, one other thing is that, we've talked a little bit about kind of the regulatory restrictions. Well, another great thing is that, we have DMAS representation at the conference. So Tammy Whitlock, who many of us know, who is one of the directors at Department of Medicaid Services, whom we work with on a daily basis as it relates to these home and community-based services, is going to be at the conference, and she's going to be there to do a presentation of what's happening within the regulatory environment of the Department of Medicaid Services, but also she's going to be there to answer questions. And while we can sit back oftentimes and say that, there's friction between the two, I can honestly say that they are great partners who really do want to hear from us and really do want to help us solve problems, because we all have that same end goal in line, and that's quality care for residents all across the Commonwealth of Virginia. And so while we don't always see eye to eye on the implementation or the process or the regulation, we certainly have the same common goal in mind. And so Tammy and her team are going to be there, and they'll be available throughout the day, and they're also going to do a session. So I think it's really important too, because we don't always, as individual providers, get access to those folks on a day in, day out basis. But this conference is going to give us face-to-face access with these folks, that we can really, have this opportunity to influence how they see us and what they think of our industry.
Bill, anything you want to add to that?
Yeah, we're going to have representatives from the managed care organizations there as well. Yep. So if you're having issues with a particular managed care company, you can have some one-on-one time They'll be there during the conference. They're going to be part of a session as well. So that's a great opportunity. It's it's difficult to get people on the phone these days, but you're going to have an opportunity for one-on-one FaceTime, and you don't get that very often, and you can get a lot accomplished with a one-on-one FaceTime at this conference.
Yeah.
Bill, I appreciate you saying that. Early in my career, I had a boss that always challenged me that if I go to a conference, I needed to come back and show how anything I learned I could implement and pay for it in productivity, profitability increases, and whatnot. And I worked my tail off to be able to do that because I knew he was going to kick my butt if I didn't. And the reality was I met some of the best resources through conferences and events that helped me get better in my craft. I'm a not terribly intelligent country boy, but man, I've been blessed with cool relationships because I worked my butt off to get to. And when I was at a conference, I wasn't sitting outside smoking cigarettes. And I'm not saying that's bad, but I was working to see who can I meet that I can learn from and interact with after the conference so I can develop even better relationships and make my company move forward because I was held accountable. So appreciate both of y'all sharing that piece.
Great. And there'll be ample time for networking throughout this day too. So, you'll get a chance to meet people. You'll get a chance to network. I love it because my agency's in Northern Virginia, so I don't get a chance to network with the rest of the state that often, the rest of the Commonwealth. And so this gives me a great opportunity to hear how things are going throughout all of Virginia, and ultimately just to kind of learn from the people in the room like Bill and others who've been working in the state a lot longer than I have and have just a wealth of information. So the networking is invaluable.
Yeah, and I can add that I enjoy meeting new people, new folks that come to the conference and networking with them. And, I can honestly say that from past conferences, I've developed friendships, relationships with other providers. And, when we have things that are new that are coming up, we a lot of times will get on the phone and just network and talk it through of how we want to address it. How are we going to implement it? So it's always good person that you can talk with to talk about changes.
Or even just a shoulder to cry on.
And
Right.
Here's the reality, Bill. It's while me and Cindy knew you from a distance, we met a year ago in Glen Allen at a conference, and that started more of the relationship.
Absolutely.
And I'm thankful for the friendship we've built since then.
Yep, me too. We've had a lot of had some more conference time together, and I'm looking forward to being at the conference with you guys.
So
Thank
real
you.
quick, I'll wrap up with a couple ideas. And Cindy, I want you to be able to jump into one of the things that Jason and Bill and the board was able to coerce me into doing is back early this year in 2024, I released a book called What's Killing Your Profitability. It made an Amazon #1 bestseller in 2 of the 3 categories it's listed in. The first 100 folks that register get a copy. And Jason, it's the first ones that I've bought personally through, had printed that I've not signed. So, and I didn't because I'm looking forward for you guys that are there to be able to sign it to you personally. And not that I think my signature means much, but I want it to matter to you that we got to be there with you, and hopefully we can provide some resource that really helps you move the needle forward in your organizations. The other thing I'll share is Cindy and I, for the last 6 years, have done a virtual series called Leading at the Next Level. Today, we've got about 150 lessons in the digital side of that course, and we do new ones monthly that we present on Zoom, and then we add the recordings over. We've offered to anyone who registers for the conference before the end of September to give a 45-day no-cost access to that, to kick the tires, see if it's something that serves them. Again, it's 6 years in, it's 150 lessons, 45 days, no cost, complete access. There's some ongoing costs if you choose to, but we're even willing to deeply discount that because we want to be a blessing to you and give you tools to capture that margin that you might be losing through maybe, I'm not going to say bad leadership, I'm going to say not as effective as it could be leadership. So anyway, Cindy, what would you like to wrap up with?
Just to tell everyone that we look forward to seeing you at the conference. We highly respect what you do in personal care, taking care of some of our most vulnerable individuals, and just love and respect you for doing that. My background was over 10 years in hospice. Wes mentioned a little of that. I think he said medical care, but hospice and senior living. So I can completely relate to what you offer, appreciate it. And Wes and I will be there throughout the day and look forward to meeting everyone. And we'll kick off the day by sharing what is killing your impact and budget. Look forward to seeing you there.
Thanks.
Jason, Bill, any parting thoughts?
Well,
Go
I
ahead, Bill.
appreciate you guys. I appreciate you guys being there. I can tell you, the folks out there listening and seeing this podcast, it's well worth the price of the admission to the conference. You're going to get a lot of value for your dollar. And I know that in this day and time, we got to get value for our dollar. You're going to get a ton of value for your dollar. And Wes and Cindy's going to deliver a huge portion of that. But there's so many value propositions. You guys just can't miss out on this.
Yeah. I think everybody said it, but I'm just, I'm looking forward to reconnecting with my Virginia colleagues and the folks that I don't get a chance to see every day. I get so much, I look forward to this conference so much. I come the day before, so I'm already there. I come in fresh and ready to go. It's my absolute pleasure to stand at the door and welcome everybody as they come in. And I truly enjoy my role on VAPCP and the opportunity that I've made or that I've had to make these great friends and colleagues and folks that long after I'm gone in the industry will still matter to me. And so, I think that I want everybody to have that same opportunity to make those same connections that I've made through my journey with VAPCP. So I just encourage everybody to, if you're on the fence, take the risk, reach out to me and I'll help you make the decision. And we'll get you there and you'll enjoy it. It won't be a decision you regret to come to this conference. I promise you that.
Outstanding. We can't wait to see everyone there. If you're on the fence, reach out. And if there's something Cindy and I can do to help in that process, we'll do anything we can. We don't know all the nuts and bolts. Jason and Bill know that, but we'll help any way we can. Guys, if you'll hold on just a second, I'll end the live feed.
Sure.
And we'll cover any details on the back end in just a few seconds.
Sounds great.
Thanks so much, guys. See you all soon.
Thanks.